Good afternoon. Thank you for your attention today. I'm Michael Barton, Director of Emergency Management for Calhoun County. Today's update is not a good update. It's a report of numbers that are continuing to go in the opposite direction of where we had hoped that they would go. It is important for each of us, though, to realize that when we talk about COVID-19 in Calhoun County, it is no longer just a number. It is now names and faces of our family and our friends. It's about real people and their lives. By this time, those who have thankfully not been infected by the virus have likely been affected by it because they know someone who has it, and they've been impacted by their family members who may have had it at this point. The surge that we are experiencing in this county has not decreased over the last week. It has continued to increase. As predicted last week, with this increase, we are now over 1,000 cases. To be exact, 1,157 positive cases over the time in Calhoun County. These are the cases that have been tested, reported, and are known. It is thought there may be many additional cases out there that have not been tested and could not have been reported yet at this time. As you look now on the screen, for those of you who are on Facebook, you should be able to see a graph that depicts the number of cases over time in Calhoun County. Calhoun County has increased for the past 5 weeks consecutively now in new cases. And as you see the sharp increase on the graph, over half of these cases has come in the last 2 weeks. That is and continues to be alarming for our county. As you know, Calhoun County has done a great job preventing the spread of this infectious disease until now. Over time, we have seen where a small number of cases were manageable and marginal. Now, that is very different. We have high community spread, and more people are becoming infected at a much more rapid rate. As one elected official shared with me this morning his concern, that this is becoming out of control. Unfortunately, some of these impacts are being evident right here in the hospital that we're in today. Many of the positive patients from this county have been hospitalized, and unfortunately, several have passed away. Several additional deaths have been reported over the past week, and to date, we believe the unofficial count in Calhoun County, the deaths stand at 11. This means that since last Tuesday, that there have been 5 additional deaths in less than a week's time. At this time, I'm going to turn it over to our hospital officials. They're on the front lines of this battle and let us know what they're seeing and the things that we need to be aware of. At this time, Mr. Lewis Bass, the CEO of RMC Health Systems, will now speak. Lewis.
Thank you, Michael. As Michael said, the numbers continue to increase and to rise in both in our hospital. We currently have a census of 48 positive COVID patients in the hospital here at RMC. Of those 48 patients, currently 13 of those patients are vented or are considered to be ICU level patients. We also have an additional 5 ICU patients in our other ICU that are vented, so a total of 18 for the entire facility. I want to give you a little bit of information regarding the age breakdown of those patients. Currently, the average age of the patients that are in our 3 COVID units is 66 years old. 28 of those 48 patients are greater than 65 years old. 14 are less than 60. The oldest patient that we have on our unit is 95 years old, but the youngest patient is 20 years old. So I tell you that to say that for those who think that this virus only affects those in my age range and above, you're mistaken. We have a 20-year-old patient. We had a 25-year-old patient several weeks ago that was vented and has now gone home. At least one of those patients I know of that's currently vented is less than 40 years old. So this virus can affect us all. It's very serious. In the month of July, we have admitted 75 plus patients to our COVID units. Over the last 2 weeks, we admitted 57. We made it through the first surge, if you want to call it that, with only 24 patients admitted to our COVID units. As of today, we have in excess of 105 admissions so far. The impact of COVID-19 on our staff has been significant. We are having staffing issues that we're addressing, but our staff is amazing and the work that they're doing is incredible every day. We are able to handle the situations that have been presented to us, but it's not always easy. We have the influx of these patients puts a considerable strain on our staff. It puts a considerable strain on our ICU and also our ability to take care of patients that come into the hospital with just general medical conditions. I urge you that if you need emergency care, and if it's not a true emergency, that you utilize our local area urgent care centers, that you utilize your primary care physicians, and that you avoid coming to the emergency rooms at either at Northeast or at Stringfellow. Both of the emergency rooms are very busy, as are all emergency rooms throughout the state. So when you come, if you don't have an emergency situation, you are going to have long waits. I repeat, you are going to have long waits. Our folks are working very hard and doing everything we can to take care of all of the patients, all of the ambulances that present at both of our facilities. So again, I encourage you, if you don't have an emergency, please utilize our urgent cares or our physicians throughout the community. I want to say one other thing. I want to thank, over this time, we've had to transport patients out to other hospitals, not only in this region, but to other hospitals in other states. And our local EMS providers have been a tremendous help to us in getting those patients out of this hospital and getting them to another location where they can receive care. Our physicians, over on my side, we have Dr. Magadi and Dr. Free. We have Dr. Patel, all of our hospitalists, all of our primary care doctors that take care of our patients. They're doing a tremendous job. They're working night and day, 7 days a week, and trying to address all of the needs of our patients. And lastly, our staff. Our staff is incredible. I just got off of a conference call, and one of the things we talked about with several other hospitals in this region was that back in March and April, and I think a lot due to what was going on in New York and in Italy, there was a tremendous outpouring from the community for our hospital workers and frontline workers. As we are now into the surge, I want everyone to remember your actions outside of this hospital impact our employees eventually, because when you show up here, they have to take care of you. They're tired, they're weary, but every day they come to work, they work extremely hard, and they do an incredible job taking care of everyone. So please, wear your mask, separate, and sanitize frequently. And that's the main thing that you can do to help us at RMC. Joe?
Good afternoon. My name is Joe Weaver. I'm the CEO of Stringfellow Memorial Hospital Facility, and while we continue to support the main campus in more of a support role, i.e. staff, supplies, equipment, etc., I will say that Stringfellow is certainly being directly impacted by this upsurge as well. Our intensive care unit at Stringfellow is at capacity, and that's primarily because we're having to take a lot of the non-COVID patients that are showing up here at the main campus who are in need of ICU beds. But again, we're pretty much at capacity in that regard. Our emergency room, because again, we've been looked at as a support facility, is starting to fill up as well. Now, we're not seeing a lot of COVID patients in our emergency room, but we are starting to see some, and we're testing those patients. And as you can see, it's very difficult to be able to transfer those patients even to our sister hospital because we're rapidly running out of space here as well. I would say that the community has to continue to help us out as much as they possibly can because we're at a point now where we're very close to capacity, and I would gather that within the next few days or few weeks, we're going to find ourselves in dire straits from a bed capacity standpoint. From a masking standpoint, I would certainly encourage you all to continue to make sure that you wear your mask, that you socially distance as best you possibly can. Because again, we don't ever want to get to the point where we say that we can't treat you. But there are hospitals across this country right now who are performing who are making those very decisions. We know that we can do a good job here. We've done a great job here in the past, and I'm comfortable that we'll be able to get past this at some point in time. But it's going to take a concerted effort on the part of everyone. Mr. Bass already mentioned that our staff has been heavily taxed and they are tired, but they have done a tremendous job in terms of stepping up. But there's only a limit to so much anyone can do, and we want to make sure that we can take care of every patient that comes to this community. From a visitation standpoint, obviously we're going to continue to restrict that policy because we see that as one more means of being able to slow down the spread of this disease. But please help us out as best you possibly can. We have great folks here, we have great facilities, but again, our capacity limits are only to the point where we can handle so many patients. So please make sure that you help us out as best you possibly can. With that, I'll turn it over to Dr. Free.
Good afternoon, Dr. Free. I'm just going to piggyback on what was said by everybody else and then just add. I just came from the emergency room, and we're tight. Just expect to have a very long wait anywhere. It's not just here, it's in other hospitals all across the state. We're doing the best we can. I witnessed 5 people in the great chairs, and this may not mean anything to you, but this just lets you know how real this is. 5 people in the great chairs, ambulances on the ramps, stretchers in the hallway, people in the annex being checked, people in the lobby, and we're working hard. We're doing the best that we can. I'm going to let Dr. Magadia talk about the COVID unit specifically, but again, as Lewis said, your wait is going to be long. Just be patient. Wear your masks. Do not go out in public when you do not need to. Self-distance, wash your hands. We cannot say enough. There are sick people here, sick people, sick to death people. And it hurts your heart when you see even young people as sick as they are. The old people as well. I mean, this could be your grandmother, your mother, your father. So if you're not wearing your mask, if you're not taking care of yourself, you could take this virus home and get people sick enough to die, sick enough to come into the hospital. So please, if we cannot say well enough to do this. We have been blessed to participate in a research study, and as you see, Moderna has a vaccine that they're bringing to trial. This, I think, is a phase 3 trial. We are going to be participating in an AstraZeneca trial that's a phase 2 that will use a particular drug that helps decrease the cytokine storm effects that affect the lungs. So, pay attention to the future. This is something that's wonderful. Help us, help everybody, please. I'm going to leave the rest for Dr. Magadia to say. Thank you.
Good afternoon. I'm Dr. Magadia. I'm the infectious disease specialist and one of the lead clinicians in the 3 COVID wards. The COVID-1 ward is the orthopedic ward. We have 19 patients there. 14 of those are intubated on the ventilator. At COVID-2, which used to be GYN peds, we have 20 patients, and COVID-3, which used to be the 5th floor medical ward, we have 10 patients there. We use COVID-3 as a kind of step-down unit. If they're not that sick enough, we transfer them there. The COVID-1 and 2 wards are the sickest folks I want to discuss briefly the clinical update, what we're doing. It's not much different compared to the first wave. The only difference is we have two medications now. The first medications that we were giving, the high-dose vitamin C, the zinc and thiamine, we're still giving those to augment the inflammation of the virus. Back then, in the first wave, we did not have antiviral medications, and we were specifically told that by WHO, CDC, FDA, not to give them systemic steroids. But now, based on data from Europe, we have been giving them systemic steroids, specifically dexamethasone, and that has tremendously given us great hope in getting these people alive. We also have now in our medication list an antiviral medicine called remdesivir. It's a directly antiviral medicine that kills the virus itself. The problem with that, it's in short supply. I just got a batch of remdesivir dose for about, I think, 11 people about 2 hours ago. Last week, we were waiting on those, so those people who were really sick last week, we were not able to give them. We have given, prior to today, we have given about 9 courses or 9 patients on that remdesivir. It's not quite a home run, but it's a hope. It's given intravenously for 5 consecutive days. Since it's not really officially FDA approved, it was given what they call EUA, or emergency use authorization. We still have to ask family members or even patients themselves to give us permission to give that drug, because there's not a lot of things that we know about this drug as far as side effects and long-term effects of that. But it's a medicine that we're giving, although we're not giving it to everybody. We're picking and selecting those patients. We preferably give it to those patients who might need to be on the ventilator, but sometimes it might be too late. So we give that drug to the ones who just got on the ventilator, including the one that Mr. Bass mentioned earlier on, a 20-year-old that we admitted 2 hours ago. Again, we're still giving the vitamin C, the zinc. It's a high-dose vitamin C. It's intravenous, and we give it for 5 days. Outside of those things that we're giving, there's not a whole lot, and I know you've been hearing and reading a lot of things in medical media or even lay media about things going on, a lot of clinical trials, but outside of those things that we're giving right now, there's nothing. There's only 3 things that could save you and your grandma and your parents: social distancing, wearing masks, and meticulous hand hygiene. Outside of those, there's not a whole lot that we could offer. So we cannot overemphasize enough social distancing, wearing a mask. It had become politicized, but it saved lives, and hand hygiene. Other than that, it's mostly supportive care. We are also, let me finish off by saying that one other thing that we're doing to patients here, especially those not on the ventilators, having them lay on their tummy. It's medically called proning. What it does, it kind of shuffles the lung tissue from the front of your lung tissue to the back of your lung. And what it does, it kind of shunts the virus towards the back of the lungs. It has been shown to be effective, especially on those people not really needing the vent. For those people on the ventilator, it's a little bit difficult to do that because they have a lot of tubes inside them. There's a lot of IV tubings, but we have done that also to some patients on the vent. Of all those things that we're doing, I think that's one that's very promising. It's cheap. You don't need a consent. It's not a drug. We also advise that to people at home who have been exposed or have laboratory confirmed COVID-19. We ask them, please prone or lay on your tummy all the time, most of the time. Other than that, that's it. Thank you.
doctors, CEOs, thank y'all for what you're doing on the front lines to protect our community. Now's the time that each of us, though, can do our part to protect our community by following the measures that these experts have shared with us today. At this time, we'll take questions from our Facebook Live audience as well as from the media that's present here today.
The now 5 patients that you say have that have probably been, or you think they've been killed by coronavirus, but they're not part of the official count. Over what time period did that occur?
That's right. So now the question is the deaths that we're reporting, now 5 additional deaths. What's the time period for that? So we believe that since last Tuesday that there have been those 5 additional deaths, one occurring about Tuesday or Wednesday, and then the other 4 occurring just over the last couple days this weekend.
How much detail can you give us on these cases? Were they here in the hospital?
So yes, my understanding is that they were here in the hospital. And of course, at that point, the Alabama Department of Public Health takes the case, reviews the case, investigates it to determine if it's probable and then confirmed, as a direct COVID fatality. But the preliminary information we have now is that there's 5 in the last week, and that brings our unofficial count in Calhoun County to 11 fatalities due to COVID-19.
There was mention of a drug trial that involves AstraZeneca. Which one? 2 drugs were mentioned earlier. Which drug is the drug trial going to be? What's it going to involve?
Okay, this drug is different than what's available here at the hospital. So the gentleman asked about the research trial, and is this drug one of the drugs in our armamentarium, and it isn't. This is a particular drug that has been used in mantle cell leukemia or lymphoma, in CLL, and hematologic cancers, and rheumatology type diseases. And it helps decrease the type of cytokine storm by decreasing the effect that the body has to fight off infection. And that's all that I can say about it. This is a phase 2 study, so the drug, we do know the name of it. I'll just tell you it's a brutinib, which means a nib meaning that it's able to be given by mouth. The mAbs we use are by IV, and that's tocilizumab that we use here. This is well, it's hard for me to say, but I'm going to say it's a brutinib, and it's a type of drug, again, that decreases inflammation. So we're really excited about this. There's a long consent that the patient has to read and understand because there are side effects that occur, but there are side effects with anything. At this point, if this is going to be helpful, there have been no findings of truly severe adverse events that I can see from previous work by investigators at the NIH. So this is going to be up and coming and very exciting. And it's Pinnacle Research that's going to be manning this.
Other questions?
How is the Unified Command working with the school systems to ensure the safety of our children? So
the Unified Command, as we've talked several times, remains active with our school systems. In the county, there are 5 public school systems in the county, 1 university, 1 college, and several private schools. We have worked to be engaged with all those at some point or another. Many of them have had representatives as part of the team since the original task force back in February, and have continued then to be part of the Unified Command. We're able through that venue to provide updates, information. All the information are available to them, as well as the resources that we have and access to the subject matter experts that we have on the Unified Command that not just look at the national and state things, but those folks who are in the trenches here on the front lines every day to day. So we continue to work with the superintendents in that respect, provide the most updated information, recommendations, and support them in any way possible for them to help make the best decisions and implement the best measures moving forward. Any other questions? Well, the Unified Command in other ways continues to be active. As we've heard, the hospital continues to be at that capacity level. As we talked about last week, we have reached out to a number of regional resources for additional staffing assistance. On Friday of this past week, we elevated that to the state level as well. Through the Alabama Department of Public Health, we have petitioned the Governor's Office of Volunteer Services for additional staffing that could come in from other parts of the state to support the efforts here locally at RMC and Stringfellow in working with both COVID as well as those non-COVID patients. As Mr. Bass said, some patients have had to be transferred to other facilities. So by us being able to hopefully bring in staff from across the state, we can stabilize that and help provide that care locally here as much as possible. So the Unified Command continues to wait on the response back from that request. Depending on what the resources are available throughout the state then, we are also positioning ourselves to be able to request federal resources if necessary in the coming weeks as well. And as we see the incline continue on the graph that we showed earlier, the cases increase. We hope that doesn't happen, but again, we continue to prepare for the worst and we work hard toward the best, and each person has a part in that by us taking those precautions individually as well as collectively to do our part to prevent the spread further in our community in Calhoun County. I would encourage each person to stay up to date on the latest information through our social media platforms of Facebook, Twitter, and Instagram. Of course, we also have our website at calhounema.org that stays up to date with the latest developments in our community as well as the state. We have our Cal COVID text notification where folks can text the word Cal COVID to 888-777 and receive instant updates on their text message, as well as we have a phone line that anybody that needs assistance can call 256-435-0540 to get the Unified Command of the Emergency Management Agency. But for general assistance, the 211 line provided through the United Way is still active and available and assists people every day in this community. So with that and no additional questions, we thank you and encourage you to stay safe. And Dr. Free has one last comment, and when she's finished, the press conference will be ended. Thank you.
Since we're talking about contacting people, Doug Scott is a vice for human resources. If there are any nurses out there, text. Anybody that can lend a hand that would like to join our great group and help us with treating patients. Don't necessarily have to treat the COVID patients. We will take nurses from anywhere. Text. We love them. We need them. We admire them. We lift them up. And if you guys could just come on and help us, we would love it. Thank you.
And we feed them.
Yes.